Well, welcome everyone. Thank you for attending. We have today our very first session of the Opioid and Workplace Summit to kick off Mental Health Awareness Month. I apologize for that. Our summit is designed to try and help you not only increase your awareness of the opioid workplace issue, but also what you can do about it. And then alternatively, what kind of doesn't work. So let me introduce myself. My name is Nick Vasquez, as you heard. I'm an ER physician. I'm an Arizona native, went away for education and came back. And through my time as at Valley Leadership, I was able to meet an incredible man, John Koch, who I hope, John, I said that correctly for your last name. I've heard other people say it differently. I'm going to hand it off now to from Community Medical Services. John.
Hey everyone, my name's John Koch. I'm the Director of Community and Public Relations for Community Medical Services, which is a company that was founded here in Arizona. It started in 1983, and it's an opioid treatment program. The reason I got involved with Community Medical Services is because I myself am a person in long-term recovery from an opioid use disorder. And part of that for me means that I get to give back today what was some people so freely gave to me. And so today I'm going to get to share some of my story, but I want to start out by saying that more than where I work, I am a person in long-term recovery that has two beautiful children, an amazing wife, incredible family, and I went from being incarcerated 26 times in my life, clinically overdosing 3 times, and being to over 20 treatment centers, to now being a homeowner, a father, a husband, a son, a brother, and so many more amazing things. But the most amazing thing for me, myself, is every single day I get to wake up and I get to be free from the restraint of substance abuse. And that isn't just because of the work I did, but it's because of the support I received over the past 15 years that I've gotten to be in recovery. If it wasn't for people coming to me and loving on me when I didn't know how to love on myself, when it wasn't for people that I didn't think were going to love on me and help me, and they did, that helped to make a difference and a change in my life. So I'm going to do one of the most fun feats I get to do in my career, and that is try to fit 35 years worth of information into 12 minutes of talking. But here's my 15-minute TED talk on
One sec before you start, because it's so powerful. I don't want to stop your thing. There was a word you said that I love. I get to be free. And I think that's the most important thing I hope you can take from this day. I went to residency with a woman named Gail D'Onofrio who does research on addiction. The way she likes to put it, the way Dr. D'Onofrio likes to put it, is that dopamine is at the heart of everything we do, everything we wish for, everything we desire, every plan you've ever made. Even from tying your shoes to having a long-term goal, dopamine is the medication or is the transmitter in your mind that gives it to you. And if there's one thing that gets hijacked with opioids, it's dopamine. These folks are not free. They are driven to repeat the addiction, just driven. It's almost like they're overtaken by this. Now, there's one other thing I forgot to mention, and I hope John can highlight it again. Humans tend to be very sensitive to judgment. It's been my experience that folks with an opioid use disorder don't want your judgment. They want your help. I have never seen stigma or shame or judgment ever work for addiction. And yet we keep repeating and trying it again. And I hope you keep that in mind when you hear John's story, that there has to be another way other than shunning and shame to try to impact this terrible disease. Thank you, John, for the side. I forgot my cue at the the last slide. Please go ahead with your incredible story.
No, thank you, Dr. Nick, and thank you everyone for being here. So, giving my talking, trying to put these 30 years of 35 years of life into 15 minutes, I'm going to highlight some areas of my life that were really instrumental in my addiction and also in my recovery. And I hope that, just to second on what Dr. Nick was just talking about, there's periods that I'm going to talk about where everything was so punitive that there was no way for a person like me to understand that you're not just doing wrong all the time and you're not going to ever be okay. And so it was through love and grace and through empathy that my life changed. And so I really want to highlight and really want you to look at the different levels of that throughout my story so that you yourself can look at it in your personal life, because we know that on this call, there's 29 people. 2/3 of you are directly affected by someone with an opioid use disorder or are affected yourself. And I say that to you because this is so common that we need to start having these conversations and need to be able to understand where people are at and how to best treat them. So I didn't grow up in any type of cult. I didn't. It was. I can explain my childhood like this. I was a kid that loved to go and I loved to run. I love to be outside. I love to experience sports. I love to have fun with my friends. I loved, spending time with my father, going fishing. I loved being with my mom and learning and singing in the car with her. I was a happy kid. But there was a thing about me I noticed at a really young age that uh, I always was seeking to get attention because I never felt like I was quite enough. And some people in here might know someone that maybe feels like that or may feel like that themselves. So I went through my younger years not knowing what was wrong. And then I hit an age where alcohol and marijuana became very available and prevalent at a very young age to me. And I started to drink and use drugs, not because I thought that this was what I was going to do with my life, but because for that moment, I felt better. I felt like I didn't need acceptance from anybody else. I felt whole. And that piece of me that all these years was missing, to wanting to feel acceptance, I got with drugs and alcohol. When I played a sport, I had to be the best at it or I didn't want to play anymore. When I went to school, I had to be either the brightest or the most funniest in class, or I just didn't want to go to it. And so when I found drugs and alcohol, it helped to fill that portion of me. And it never ever was part of my story as a kid that I thought by the time I am 24 years old, I will have been in prison, jail, I will have been stabbed, I will have experienced horrible experiences in my life, and I will have lived on the streets. It was never part of the picture. My father was he retired a corporate executive for a Fortune 500 company. My mother is this sweet traditional Southern belle that doesn't leave her hair and doesn't leave her room in the morning till her hair's done. And they both just, they tried to do everything they could to surround me with love. But my parents also um, they were traditional Southern folks that were very conservative and did have a punitive mindset and on how to treat things. And so when my parents found out at a young age I was involved with drugs and alcohol, they started to insert certain things into my life, such as the police, such as different avenues to try to help to save their son. They thought at the time, but at the time it was actually affecting me in a traumatic experience. There's things that I went through due to those arrests and spending time in jail as a juvenile, where I was taken, where life was not good and I was not safe. But through that period, I took my rage and how I felt about different things, and I put them into drugs and alcohol. And by the time I was 14 years old, I was arrested and I was sent to juvenile prison on theft charges and robbery. And by the time I was 17, I had been incarcerated 15 times, and I had spent majority of my high school in jail, and I was facing adult charges. So I'll tell you a piece of my story is I was sitting, and I hope you can view through this how powerful addiction is and a substance use disorder, how strong the grasp of opioids are on a person's brain. So I was 17 years old. I was in my high school SAT prep class. I had the special desk, the one right next to the teacher facing the wall. I was always a distraction because I believe it or not, I learned pretty easily. So my time I spent outside of that was usually trying to talk to my classmates. So they put me in this special desk so I wouldn't interfere. And then as part of that went on, I was sitting in this SAT prep. The school dean and police officer knocked on the door. I was sleeping on my desk. I poked my head up and they said, "Can we have Mr. Cotch?" When I stepped into the hallway, there were 6 police officers. They asked me to get on the ground. They then searched me, put me in handcuffs, and took me out of school. I was 17 years old. They told me, "Mr. Koch, you have been arrested on a Class X felony, possession and distribution of 30 to 1,000 grams of cocaine." This was not a picture of my life. I did not have this as part of it. From there, I was taken down to the station where I was questioned, and then I was sent to prison or sent to county jail where I sat. And I remember my first day, they gave me a bond, and my bond was $75,000 to get out. Now, my family like didn't have this type of money, and they weren't able to pay for these type of things to get me out of jail. So I sat in jail for the next few months while facing charges for this. And I remember the first time I went in front of the judge, and I was going to ask for a bond reduction, and I was going to see if there's a way I could possibly get out of jail. And I remember I was sitting there, and when you sit in court and you're waiting to see the judge and you're incarcerated, they usually put you in shackles on your feet and your hands. So you're sitting like this, and everything's all together. And then the state's attorney's talking to my public defender. And the public defender then walks up to me and goes, "Well, Mr. Cotch, I have good and bad news for you." And I said, "What is that?" He said, "Well, the state just gave you your initial offer, which is usually your best offer, and they're offering you 23 years in the Illinois Department of Corrections." I'm 17 years old. That means I would still be in prison today. I said, "What else can we try to do?" He said, "Well, I'm going to go talk to your mother and father about this, but what we can try to do is we can try to get you a lower bond." And so that's what they did. And my family got this money put together for me, and it was quite a bit of money, and they helped to get me out of jail. And when that happened, I remember I stood in front of the judge, and his name was Judge Schonstedt. And if you've ever been in a courtroom, the judge sits above everybody. And I'm looking up at this judge, and he's looking down at me, and he says, "Mr. Koch, I hope you realize that if you so much as to come back into my courtroom with any drugs or alcohol in your system, I will do whatever I can, however I can, to give you as many years as I can. Do you understand that?" I looked up at the judge and I said, "Yes, sir." The whole time in the back of my head, I'm thinking, you're going to let me go and I'm going to go get high. I just got offered 23 years in prison at 80%, meaning I will serve about 20 years of that. I am looked at by a judge who my life is in his hands. And the second he gives me a hint that he's going to lower my bond and there's a possibility that I can get out, all I can think about is Oxycontin and heroin. I didn't want this. I didn't want to hurt my family. I didn't want to go home that night and go to dinner with my parents and then get picked up from by a friend and go to the west side of Chicago and buy drugs. But that's what happened. And because I was so scared to talk to anybody about it, and because my addiction was so strong, I felt like I had no resources. So I just went right back down this path, right? Of hiding my addiction. That's a common thing that we see is people hide their addiction because of the stigma and judgment that they will receive. When if they did not feel as if they were going to be stigmatized or judged, they are much more likely to come up to you and say, "Hey, Joe, you're my person. I'm struggling. What can I do? How can, who can I reach out to?" So just remember that when, you're dealing with somebody that has an opioid use disorder or substance use disorder, is they don't want to hurt themselves like that. But it's got such a strong grip, as Dr. Vasquez was talking about in the beginning, that it continues to drive the decisions they make. So after this, I was released from the county jail, not too much longer. As you could hear where my mindset was at, I was reincarcerated and I was sent to prison for the next 7 years. I was actually sentenced to 14 years in prison, 7 years. Part of my sentencing was I would do 50% of my time at 7 years. And from about the age of 18 to 20, or 2 weeks before my 21st birthday, I was incarcerated in the Illinois Department of Corrections. And part of that was when 2 weeks before my 21st birthday, I got a knock on my prison door. Now, mind you, I have 3.5 years about left. I get a knock on my door, or my door pops, and I step outside, and it's my prison counselor, and he says, "Mr. Cotch, the governor of Illinois has agreed to release 1,000 nonviolent inmates. You fell on that list." I said, "Okay, what's that mean?" She said, "I need you to pack your stuff right now. You're going home." I had 3.5 more years. Nothing else could tell me more. The most excitement I felt was not to go see my family, was not to go experience life, was I'm going to go get high today. I've been thinking for the past 3 years on how I'm going to not get high when I get out. And that's the first choice I made. It's not because I'm a bad person. It's not because of a moral failing. It's not because, I didn't know better. It's because my response to any type of activity that was different in life was to use substances to shut my brain up. And that's what I did. And I was dang good at it. So I got out of prison and I was put on an ankle monitor. And not too long after that, it was Thanksgiving. And my parents are sitting upstairs, and a friend of mine stops by and comes into the basement with me. And he just so happened to have a $20 bag of fentanyl. We split that bag. It was my first time using opioids since being released from prison. I actually used less than probably half of it because I knew where my tolerance was at, and I overdosed. And I tell you this next part because the scariest thing in the world for most of us is death. So I overdosed. I started to turn blue. My friend called 911. Thank you, God, at the time that he did that. And I was awakened by the ER staff standing over me. They had told me that I'd just been rushed to the hospital, that I had overdosed on fentanyl, and that I was hit with Narcan, and that they had to use 6 times the normal dose to bring me back. While I was in the hospital, this was in Illinois, opioids cause you not to use the restroom. And as part of that, they wanted a drug test from me. This was stigma that at the time was held in against people that were overdosing in Chicago. ER people, and Dr. Nick can speak to this more, but ER folks eventually, hopefully they don't, but some do become numb to seeing so many overdoses, and especially in the area where I was at. And so they see this and they see this and they see me and they're like, man, another frequent flyer. And
Mm.
so instead of being treated like a human being, and when I was told I needed to give them a drug test, and I said, it's a struggle for me to pee right now because I used opioids. And they said, well, if you can't pee in this cup in the next 2 minutes, I'm going to call security and they're going to hold you down and we're going to stick a catheter inside of you and you're going to give us pee that way. And that's
Just so you know, that's a threat that will never be carried out because that's called assault. We don't do that, but it is a threat.
yeah. So that happened to me that day. Some people came in
Really?
and they did hold me down, and
Ugh.
I was stuck with a catheter, and that was one of the reasons that helped to really strengthen me in wanting to start to advocate for myself, right? Over time when I got into recovery. But I wish I could tell you that this overdose was the last time this happened. The fact is I woke up in that hospital and my father's there with me. And my dad's a big man. And he's one of the most people I care about the most in the world. And he's got a big old beard and he's this very, very successful businessman. And I'd never seen him cry. The old man was looking down at me with tears running through his eyes to his beard. And he said, son, why can't you just quit? I said, I don't know, Dad. I proceeded to leave the hospital and go get high. Not too long after that, I violated my parole and was put on some really strict guidelines. From there, I had two more overdoses that ended up with hospitalizations. Um, I didn't want this in my life. Never wanted to die as part of this, but that's what it led to in my addiction. And the last time I was in the hospital, I woke up and I was on the cardiac floor, and my parents were standing above me, and I had numbness throughout my body, and my parents were standing above me, and I looked at them and I said, "Why? Why couldn't you just let me die?" My parents proceeded to leave the hospital that day and put a restraining order on their son. I didn't talk to my parents for several years after that. I left the hospital, and when a warrant was put out for my arrest by my parole officer, and then I ended up catching another charge, and I ended up going back to prison for another 3 years. When I was released from prison on December 12th, 2000, or December 7th, 2012, I didn't know what to expect. All I know is I want to do better. But I also know that there's one way of life I know. When I was in prison, I wrote my father a letter saying, I want to be a son. I want to be a part of your life. And he ended up writing me back saying, I can't, I need you to stay away. I'll pay you to stay away. And so I was released from prison. And to wrap this up, you hear all these horrible things that I had experienced in life. And I tell that to you because if it wasn't for a police officer that pulled me over one day and instead of taking me to jail, took me to treatment, I wouldn't be where I am today. I got to go to treatment, and through that, I ended up receiving. I ended up breaking the record for the longest person in treatment they'd ever had because I didn't know how to live my life. I followed all their directions. I went to the Sober Living's halfway house and several other places. Right, I never had a real job at this point, and I'm getting out of prison for the second time. I'm in my late 20s almost, and I never had a real job. Today my life is so much different. As I told you in the beginning, these I have an amazing family. I have two beautiful children and an amazing wife. My job today is I work for Community Medical Services. We're an opioid treatment program, the largest in the state, one of the largest in the country. We pride ourselves on putting our patients first. Um, but I tell you that because I never thought I was going to work in this field. I never thought I was a union guy working in construction before this. I never thought it was going to be an option for me. But one day I got a call that there was a big grant in Arizona to get people hired to be peer support specialists and go into the jails and help people. And I said, I don't know how much they're paying, but I don't really care. I want to do something that makes a difference. And through that, I got to go interview with one of our speakers tomorrow, the CEO of the organization that I work for, Nick Stavros. And Nick is one of my favorite human beings in this world, because Nick, for the first time in my life, for a job, he didn't look at me as if I was going to be a liability. He looked at me as if I was going to be an asset. And he treated me like that from the day I started with the company. And I started off as a peer support specialist. Some people would say that is, your baseline entry level position into behavioral health and substance abuse. Today, I'm a director over 11 states. I oversee the public relations and community relations for 91 opioid treatment programs across the United States. I work with uh, private equity companies on how to use capital funds to expand growth. I work with communities, mayors, and governors to help to explain what is going on and where we can make the biggest difference. Um, and through that, well, none of that would have been possible if it wasn't for Nick, if it wasn't for my boss, David Thurlow, if it wasn't for a guy named Michael Eggers and Jim Mason and all these leaders that gave me an opportunity and then taught me. Um, so I tell you that today, as business owners, leaders in your business, um, you never know who can be your biggest star, but they can't shine if you don't give them a chance. So working through this, please look at this and really, really, I know not every, it's a case by case situation, but know that people with a substance use disorder are people that are worthy to be hired, are worthy to work in any type of workplace, and can be trusted. So it's all about the support and help that we give them. I thank you guys for listening to my story today. I could talk about it for hours, but I want to give Dr. Nick and everyone some more time.
Man, I've heard that story a number of times. It never gets easier to hear. Man, thank you for telling that. And I am really glad you took a turn. I've had patients that didn't. I've, I always like to say ER is life, death, and everything in between. And my least favorite conversations are with parents, which thankfully I don't have to have that often. Okay, so one other thing to remember is you heard his story. You heard his experience of being driven. I think one of the things that I'd like to highlight is exactly how quickly, as at least it had been in my experience, and John, you please add in, how quickly people's antenna will go up for judgment. And no matter how much you try to give a signal, nonverbal or otherwise, that this is unacceptable, it doesn't really get through because most of the folks are sort of been hijacked. They're not thinking. I have a almost teenager daughter, and I can assure you, 14, 15-year-old kids are not thinking about what's going to be the consequences of my actions 10 years from now. They're thinking about today. They're thinking about right now. And whether it's opioids or whether it's, say, another disease, diabetes, for example. Diabetes gets a lot of stigma. People with diabetes, they're seen and sort of judged for the food that they're eating or for the choices that they make personally. It's almost like it's ingrained in people to sort of have this first instinct that any problem a person has is a moral failing. And if we believe that, then we have lost the ability to make an intervention. I can't treat diabetes without insulin. And one of the reasons that I love community medical services is that I can't treat opioid disorders without Suboxone or some type of medication to replace the addiction. There needs to be some sort of medicated assisted treatment, and one of the only organizations that I've found in Arizona that does that. is community medical services. All the other organizations, unfortunately, give a healthy dose of, stiff upper lip, suck it up, and we're going to get you through this. Most of the addiction is driven. People are driven by the addiction because they don't want to hurt. Once you get addicted to opioids, your sensitivity for pain goes up. Your ability to reduce your own pain through endorphins in your mind goes down, and they just don't want to hurt. Um, Try and tell someone who's in a lot of pain, no, 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 what you need to do is just be tougher. Or what you need to do is just kind of suffer through with it. They're not really down with that. Most folks aren't. You need to have an alternative, and that alternative can be opioid treatment. And just look on this slide here how prevalent fentanyl is. It's been scary for me.
Yeah, just
So go ahead.
no, Nick, I wanted to just highlight the points on this screen so people can understand like what the availability and how prevalent, as Dr. Nick was talking about, fentanyl is in our community right now. So as I explained, I get to work through 11 states, and I get to work with city leaders, the DEA, all different departments in these states. And I will tell you that right now in the state of Arizona, fentanyl, which are called, a lot of people refer to as blues or the blues pills, M30s, they're going for 50 cents a pill. People are trading cigarettes for the pill. That is wild, to say the least, for you guys to understand. In Seattle right now, same drug is going for $10 a pill. In Minneapolis right now, the same drug is going for $15 a pill. So to tell you that, because 51% of the United States fentanyl comes through the Arizona border. And so the value of it and the availability of it is very prevalent here. It's very cheap. I have talked to dealers that are doing 3 for $1 when it comes to fentanyl pills. So it's a habit that can be withstood for a period of time. The one thing that's different uh, with fentanyl and the availability is it's not regulated. Nobody knows how much. So you get these blue pills, and one pill might have 1 microgram, and then the other one has 5 milligrams, and that's going to kill somebody. So that's what we're up against in our streets and in our businesses. And then community medical services, we've seen in 2017, next week is National Fentanyl Awareness Day on the 7th. And so in 2017, we saw 5% or less of our urinalysis had fentanyl in them. I just checked with our chief science officer, and 97% of our urinalysis now have fentanyl in it. I talk to people on the streets and they say it's hard to even find heroin anymore. So, and just to shine a light on that, fentanyl is 50 times more potent than morphine. So, with that, it is a very strong drug that can kill you just off of a single use. And so,
Um, Yeah, so pre-pandemic, I got the privilege of sitting into a statewide opioid meeting and sat with my mouth open, surprised, seeing both the Department of Public Safety from Arizona and Department of Homeland Security from DC have representatives up there who both said the same thing. Don't send them to prison because we can't keep it out of prison. And don't think that we can stop it at the border because we can't stop it at the border. Uh, there are there are 3 places in the world where heroin was grown. Poppies, for example, they told us. Uh, 2 of them are in Asia, Afghanistan, Burma, and then one of them was in northern Mexico. And fentanyl has put those people out of business. It's much easier to make. It's much easier to acquire in large volumes. the authorities who we entrust and put in control of both our borders and our prisons told us pre-pandemic that we can't stop the flow of drugs. We need to find a better way to support our communities. And that's when I became very convicted that we needed to confront our habit to treat these diseases with judgment. Stigma in policies is easy. Do you reach out or do you make someone come to you? Do you make them fill out a form to admit to it, or is it an open form or an open process? How do you go about helping people? Do they have to admit it? It's often very difficult for people to admit that they have a problem. When I was in medical school, we had a suburban mom who had become addicted to oxycodone and Percocet. And she had a point in her life where she had multiple different identities, multiple different insurance policies, and an Excel spreadsheet to keep track of which pharmacy she had hit at what time, and what name she had used and what insurance she had utilized. When I say that dopamine is the chemical that drives us to consider how we want to solve a problem, how we want to achieve a thing, opioids hijack that. If it's prevalent, if it's powerful, if it's pervasive, then we really do need some other way other than judgment, stigma, and shunning in prison in order to be able to treat this, which is where we find ourselves here today. We hope that you can really play a role. Business is essential. It has creeped into your business. I can promise you this. I don't know specifically who. I can't tell you how to figure it out. We have docs who've struggled with it, but I can guarantee you it's in your business. And if you want to open that door to give someone a chance, like someone gave John a chance, like someone hopefully will give your kid a chance if it happens to them, then please take use of this opioid use disorder business toolkit. Find out what you can do within your business. There's this quote that I looked up many years ago and saved. And I'm going to butcher it, but I'm going to try and paraphrase it here, which is that I am only one, but I am still one. I cannot do everything, but I can do something. And because I cannot do everything, I will not avoid doing the something that I can do. It's hard for people when you're caring to want to change the world and to see it not change, but you can change a small corner, which is where you live. And that makes a positive step. If you use this toolkit to kind of look over your HR policies, to look over whether or not, if you put yourself in the mind of someone with an addiction, whether or not this is triggering for stigma or signifies stigma or not, is a good question to ask in your policies. And the more stigma you put, the more barriers you put, the less people that are actually going to utilize this. These aren't folks that are thinking long-term, they're thinking right now. How do I survive this right now? How do I get my next fix right now? They're not thinking long-term, or they're not thinking of the consequences, even though some part of them really wants to be free. I have never met someone who was in the midst of their addiction who was pleased about it. There are some people that are farther into their addiction, but it's really a hard thing because I can't use logic. I can't sit there and go, this isn't a good thing for you, is it? And they'll go, no, it's not. But the first thing they want to do when they get out is go get high. We have, in emergency medicine, we have shifted from judgment to harm prevention. We want to give out free naloxone now. We want to give people Suboxone now. We want to get people treatment now. We have had to switch away, and it's still hard for us. We're just still people too, but we've had to switch from preventing the addiction to simply trying to keep people alive. The most dangerous point for an opioid addict is after they go to prison. Once they get out, and the first hit that they do, they don't have a tolerance anymore, and they're going to overdose. It happens all the time. This toolkit here is something that you definitely can use. I would recommend that you visit the site and explore more on the toolkit. John, any thoughts?
No, I would love to answer or help with any questions. And then I also know that this is a personal topic for a lot of people too that might be in here. So just I want to extend myself. I will put in the chat my email and stuff to please reach out if you yourself or someone you know may need some help or just somebody to talk to.
Hey, John, there's a question in the chat about a 24-hour clinic open. I know you guys have one. I can't
Yep.
remember which location it was. Part of that opioid response pre-pandemic was that we were going to stand up an intake clinic to open 24 hours, 7 days a week that can do medication-assisted treatment. Where is that clinic?
Yeah. So community medical services operates a 24/7, the first actually in the United States opioid treatment program. And that's over on Cactus and the I-17. If you didn't know this, if you go to Arizona Department of Human Services website, they have a opioid dashboard. If you look at where overdoses are happening as part of that, the I-17 corridor between Peoria and all the way down to Indian School is where majority of our state's overdoses are happening. And so as part of that, CMS put a treatment program that offers 24/7 access to care there. And it also offers you so what that does is, like back when I was using drugs, in order to get into a clinic to get help to receive the medication assisted treatment, such as Dr. Nick was talking about, you had to get put on a waiting list.
Hmm.
CMS got rid of all waiting lists. We do not have a single waiting list in our whole entire company. We are able to use telemedicine and other services these days to help meet people where they're at. And so through that, it's been a great avenue. But yes, providing 24/7 ability to get into treatment, because there's this moment of hope factor. And I didn't get to cover that in my story, but I truly believe in the moment of hope. Um, you know, I believe that when you have a good doctor like Dr. Nick who's working in an ER and that person comes in and they've overdosed, and you have a person like Dr. Nick talk to them and give them a little bit of hope that things could get better or they could change or they can live their life differently or whatever the case may be, that's that window when we need to grab a hold of somebody and hug them and love on them, because then they are more accepting of receiving treatment and going to a place. And then we want for that guy that comes in at midnight and has that overdose, and you got to tell him, hey, you can't get into anything until 7 in the morning. We might never see him again.
Yeah.
But if we can have them open that, that's why it's so vital to have that. There's in the East Valley, there's the Mesa on Main location that has the longest, most extended hours outside of our 24/7 facility. That's open 16 hours a day. And then the 24/7 on the West Valley.
Yeah, every time I talk with somebody who's opened up an opioid use disorder clinic, they fill up with patients faster than they can find, time slots for them. And I don't want to. One thing I want to say before we go on is it's not those kids over on the I-17 corridor. It's everywhere. Opioid use disorder cuts across any ethnic, social, economic, any racial group. It's across all society. Everybody's at risk, including my kid. And we've talked to her about it, but it's just the nature of the beast. This stuff is very addictive. All right, Paige.
Thank you, Dr. Nick. Thank you, John, for this amazing story and information. I'm sure everyone got as much from it as I did. We did want to open it up for some questions from the audience, so please feel free to submit your questions so that we can take advantage of John and Dr. Nick's expertise while we have them. And we'll be happy to answer those for you.
Paige, just one thing. If you've never seen the show Trafficked, there is a episode 2, season 1. She follows fentanyl from Mexico across, and it's just unbelievably easy. It was just amazing how easy it was. But I'll send that to you if you ever want to watch it. It's woof. Caught my eyes.
Yeah, and Nicole shared, well, actually, sorry, we have a quick question. The window of time when someone is interested in getting help can be very narrow. What's the first thing to do when they indicate interest in pursuing recovery?
So for me, I'm very immediate sort of thoughts. I'm going to assess them for withdrawal. I'm going to assess them for abuse. I'm going to assess them for all that sort of stuff. It's not an ideal world out there. If I'm in Chandler, for example, which I have been, treating a patient with opioid disorder who wants to get help, I have to remember, oh yeah, community medical services. Most of my social workers will, through no fault of their own, refer to alternative places because that's what they know, that's what they're familiar with, and they don't do they don't do medication assisted treatment. So I'll have to remember with my patients there to talk about it and make sure that they got naloxone. Do they need Suboxone here? When was the last time they used? I'm dealing with the immediate stuff. And then after that, talking about what's the next step and how is that going to happen? How do I get you into treatment? And it's hard. You increase the opportunities, you increase the chances, you try to get them as quick as possible, but it's not a perfect world. Someone needs to drive them there. Sometimes that's a hard thing. Uh, if you stop for a second in your own life and ask how many steps would have to happen before I became homeless, how many things would have to fail before I became homeless, there's a lot of them. There's a lot of steps that a lot of people who would stop and protect you. All of those things go away. All that support goes away the moment that you start on addiction. It's a rocket slide. And a lot of folks withdraw. A lot of people withdraw from folks. So many of these folks that we're dealing with who are homeless and on fentanyl are really struggling to get support. I'm not saying anything you may not already know, but that window is narrow, it is difficult, and from an ER point of view, all I can do is what I can do, which is in the emergency department. At least I can give Suboxone, or I can write some Suboxone for a short period of time and make sure they got naloxone. Beyond that, I don't have much control.
John, what would you say, from more of like an interpersonal standpoint is important for people to be aware of in that moment of, sort of like that pivotal moment? Dr. Nick was able to talk on sort of the medical standpoint, but from a very like a friend, a family member, what do they need to be aware of when that person is looking for help?
Yeah, if someone comes to you and acknowledges that they want some help, one, the first thing I would always do is thank them for coming to you and trusting you with telling you this information, because the hardest step probably has been to tell you that information. And so now, as they tell you that information, um, beginning to support them in finding the resources. So I often will talk about a 90-10 method, and some behavioral health places talk about this, but you're going to have to do a lot of work to help that individual right in the beginning, because they don't know how to do it themselves. There was times when I would get pulled over and in my head I would feel relief because I knew I was going to go to prison. I knew how to live in there, but I didn't know how to do things in the outside world. So when it came to that, it took some people to help show me how to do this, to help hold my hand. So I would strongly recommend something like that. It was just even that officer that pulled me over and looked me in the eyes and said, "Kid, it looks like you need some help. Let's get you some help," and then follow me to the treatment center. Not to arrest me, but just show me support that he's going to be there, and gave me a hug when I went in. That's how we can help on an interpersonal level. And anybody can do this stuff.
Mhm.
And I always challenge people this. When you see somebody out there struggling, they're on the corner, or they're walking down the street, and they might not look the way that we all like to see somebody look. Just remember that they're somebody's son, father, brother, mother, sister, and they they do deserve to be treated like a person, and
Mhm.
they do deserve help.
I
Absolutely.
will say this, one last thing I'll leave you with. I mean, I agree with that, but it's been my experience that what we struggle with can become the gift that we give, if we're given a chance. And I can't think of a single person who better embodies that than you, John. So thank you for your story. Thank you for your work. And I appreciate what you do.
I appreciate you, Dr. Nick. I appreciate Valley Leadership, and I appreciate everyone that joined on here and shows interest into learning more about this stuff, because it's people like you that are help to make the difference, that can go share the message, that can talk about the stigmas that you heard about today from Dr. Nick and I, and how we can help combat them. It is not going to be an individual effort. We know that there's about 15 million Americans through a recent study that have untreated opioid use disorder. 15 million. We know that between now and 2022, there's supposed to be around 1.2 million overdose deaths. It's on us to help get in front of this and help make a difference. So thank you guys so much.
Thank you everyone for joining us today. Be sure to register for our other 3 sessions if you haven't done so, and we will also be sending out a recording of today's session. So thank you again for joining us. Hope you all have a great rest of your day.